Good day, one and all. This is Vinod from Medical Education and Research Development Unit, and today I have the honor of sharing my views and thoughts regarding teaching tools for the postgraduate trainer in the domain of knowledge. I would like to discuss this topic broadly on two headings with you all. One is teaching on the run, and then micro skills for clinical teaching. Teaching on the run. It's called teaching on the run, as most of you are very well aware, because clinicians perform multitude of tasks in a workplace setting where the learning is happening, and you need to use small amounts of time to train the trainer. So in that small amount of time, in a short period of time, when you have to really teach or impart knowledge to the trainee, you need to have skills, and those skills are divided into small elements of micro skills. This is what I'm going to try and discuss with you all. What is the most important role of a clinical teacher in a clinical learning setting? Undoubtedly, it is effective clinical supervision. Now, what is clinical supervision? What is the purpose of clinical supervision? What does literature tell us regarding what is the purpose of clinical supervision? Let us have a close look at it. Clinical supervision, as provided, the definition as provided in literature, the provision of guidance and feedback on matters of personal, professional, and educational development in the context of a trainee's experience of providing safe and appropriate patient care. I would request your kind attention, especially to the last segment of this definition, in the context of a trainee's experience of providing safe and appropriate patient care. So, from this definition, what do we get? The most important focus, the purpose of clinical supervision is to ensure patient safety in the training setting. Definitely, we all know clinical supervision needs to ensure learning also, but the utmost, most important priority of clinical supervision is ensuring patient safety. Supervision is said to have three functions: educative, supportive, managerial, or administrative function. In the provision of appropriate patient care, there underlies the element of trainee, the training of the trainee, which is the educative element of or educative function of supervision. Providing that educative function does not cannot happen without the supportive functions. The supportive functions are to provide opportunities for deliberate practice as well as reflective practice. When the trainer provides opportunities for deliberate practice, he is functioning as a coach. And when the trainer is providing opportunities for reflective practice, he is functioning as a mentor. Both these functions enable the trainee to develop knowledge and skills required to be competent. Then the supervision also has a function of managerial or administrative role, where the supervisor needs to ensure the completion of task. So in that, he also functions as a manager or administrator. So the purpose of clinical supervision, we mentioned the primary purpose of uh, clinical supervision is ensuring patient safety and care. But you can see that in that process of providing patient safety and care, the other purposes are embedded. But these purposes needs to take a significant amount of our time, which are educating the trainee, promoting high standards, identifying trainee problems, supporting the trainee, monitoring the trainee progress. So, in the process of providing adequate and appropriate patient care, the rest of the elements are embedded and it needs to happen. So, that is the time when the clinical teacher, who is trying to juggle a number of activities in the clinical workplace setting, is trying to perform teaching on the run or teaching when the time is limited. It is to be remembered that the quality of supervision has a greater impact on clinical competence and knowledge than does the number of patients seen. Even the smallest amounts of teaching time which you can offer, the trainer can offer, can have important learning opportunities and can have significant impact on the acquisition of knowledge required. There are three essential steps which are to be performed when teaching on the run. Step 1, identify the learner's needs. Step 2, teach rapidly. Step 3, provide feedback. In the step 1, as the clinical trainer identifies the learner's needs, the trainee's needs, he or she will only try to provide whatever necessary advice only on that need, not on the entire topic or not on the entire case context. This will allow the clinical trainer to focus his time on that specific learner's needs. This needs to be very clearly remembered. And that teach rapidly is possible when you are trying to focus your time and the opportunity on only teaching what the learner needs. It becomes contextual and it becomes the most appropriate way of ensuring long term retention of the knowledge which is provided. Most usually, in the teach rapidly segment itself, there is provision of feedback, but it is given as step 3 to ensure that the feedback is provided or to stress the importance of providing feedback. So, now let us look at the step 1 in detail, identifying the learner's needs. In the step 1, identifying the learner's needs, in the short time available, the clinical trainer needs to assess the learner's level of knowledge quickly. Determining the learner's needs will help you focus your teaching time to those needs. So, it is to be kindly remembered that there are not much of time available. So, we will not be able to describe or narrate the whole clinical context, or we will not be able to listen to the narration of entire clinical context. But to then identify the learner's needs, to understand the learner's level, where the learner is or where the trainee is, you need to ask the right questions. Those questions are, for example, have you encountered the situation before? Which will actually help us to understand, yes, the trainee has some amount of experience on this. And based on that, we will go to the next question. What do you think we should do next? Again, that will help you to understand what are the levels or the level of knowledge the trainee has. The most important armament a clinical trainer has in his repertoire is the right questions. If you ask the right questions, you will be able to understand what exactly the trainer level is, trainee's level is, and then you will be able to assess quickly what you need to ask the learner to do. You need to ask the trainee to do. It is also important many times that to understand the learner's needs, if you have the opportunity along with the trainee, if the trainee is clerking a patient or having the primary encounter with the patient, use that time without intervening to observe and to understand the trainee's level or need. This step is so important that this will then guide the next two steps, teaching rapidly and providing feedback. Let us look at then the real important step, teach rapidly. We do not have that much amount of time. So we require some theoretical models which will actually help to focus our teaching or training role to the needs of the trainee. These models, there are many models available. Some most important ones, let us discuss quickly. The 1 minute preceptor model, the SNAPS model, the activated demonstrations, and case presentations at bedside. All of them might not be possible within a surgical context or setting, but outside the surgical context or setting, whenever you have the small amount of time with the trainee, Each of these model can be used to train or to provide knowledge or to teach rapidly. Step 3 on in the teaching on the run is to provide feedback. Ensuring providing feedback is essential for the development or professional development of the trainee. Provide learner with a description of their strengths and recommendations for improvement. Do remember to provide first with what went well, then going into what needs to be improved. I would request you all to kindly use appreciative approach rather than fault finding approach. Appreciative approach is what is the strength of the trainee, identify those strengths, reiterate back to them, and then let them know there are some things, there are some elements which they need to improve. This is the time when you really provide the opportunity for reflective practice, enabling self learning ability, independent learning ability in each of the training. Be careful to provide specific descriptive comments about learners' performance, not evaluative comments. When I say evaluative comments, you did good is an evaluative comment. You did bad is an evaluative comment. But at the same time, when you are saying you did that process completely, the process, all the steps of the surgical procedures were in place. You ensured appropriate patient safety and patient care. All such kind of comments are descriptive comments, but even it can be even more descriptive. I'm sure you all are better to actually decide on the descriptive feedback, but kindly do not use evaluative feedback. Now, looking at these three steps, identifying learners' needs, teach rapidly, and provide feedback, all these are embedded in the models which we are going to describe in the next segment. These models will help you focus your whole time into teaching. So the next models which we are going to describe involves or has the elements of all these three steps embedded in them. So let us look at them one after another. 1 minute preceptor model. 1 minute preceptor. It basically says that it requires a minimum of 1 minute, or it can be the whole teaching can be completed within a minute. But naturally, it might go beyond a minute, but it basically means that it is a very short teaching segment. It involves identifying the learner's needs of each individual learner, teaching and providing feedback using a 5 step approach. Let's look at the 5 steps. Get a commitment about what the learner thinks is going on with the patient. Probe for underlying reasons or alternative explanations. Teach a general principle. Provide feedback about what learner did right and correct any errors by making suggestions for improvement. Let us look at an example of 1 minute preceptor model. Case presentation of an 8-year-old girl who was presented with fever and petechial rashes. I know this could be a rare case. This was once when I was in service in Nepal, and I was the medical microbiologist. And I was called to help the clinician at the bedside. So then later he used this as an opportunity for teaching his trainer too. So the trainer asked the learner, "What's going on? What do you think is going on?" So that is getting the commitment on also identifying the learner's needs. Learner is thinking, I think it's an invasive meningococcal disease, probably with meningococcemia. Then probe for supporting evidence. What led you to the conclusion? So now the learner says the signs and symptoms, the fever, the petechial rashes, the neck rigidity, all these indicates towards a meningitis symptom and also then the petechial rashes. And the microbiologist also confirmed with impression smears the presence of meningococci or the diplococci gram the appropriately gram-strained diplococci in the impression smear. Right. So in such a situation, the facilitator asks, "What would you like to do?" I would like to confirm my findings. And if you agree, start on antibiotics, no allergy history, and successfully treated with cephalosporins in the past. So I think an IV cephalotaxime is a reasonable choice as an initial treatment. So these two segments of getting commitment and supporting evidence actually makes you aware how well prepared this candidate is, how well prepared this trainee is. You identified the needs of the trainee. Now, here the need of the trainee is only for you to reconfirm whatever he has done. You can understand this trainee is quite well learned. Now, if the trainee is not very well prepared or learned, he will definitely make mistakes in these two elements itself, which will make you understand, yes, whether you need to reconfirm or re-examine the patient and then train the learner more appropriately. Now, after this, after getting commitment and for supporting evidence, now this is an opportunity to quickly teach what he or she needs to do. It does sound like, yeah, invasive meningococcal disease, and your key features, history, and the symptoms all points towards that. Yes, but what would could be the reason for the child to develop an invasive disease? Is there an immunodeficiency? Definitely, you need to kindly look at what could be the underlying reason. At this moment, let me bring you to the underlying reason, which could be a terminal complement component deficiency. This becomes a quick opportunity to teach a general principle and also uh, make the learner remember about continuous prognostic measures to be taken in such kind of a disease. Now it's the feedback time. So we identified learners' needs. We were able to quickly teach general principle, reinforce what was done well. Yeah, you did a great job at putting history and physical examination findings, and your treatment plan is good. Now, definitely make some recommendations for his further learning. Uh, Please do look at an evidence-based review on invasive meningococcal disease, and also do refresh back your basic immunology to link your basic understanding with the uh, existing this case, and it's a great opportunity to learn. So such 1 minute, it does not take much time if it is a prepared candidate. If the candidate is not really prepared well enough, yes, definitely you know that it could be uh, uh, it could take slightly more time. Although this was more of a medical and or more like an emergency kind of a case, the same technique can be applied in any setting. Another model, which could be quite useful in a surgical setting, is activated demonstrations. Now, here, the trainee is observing the surgical educator, the clinical teacher at work. The trainee needs a specific assignment to complete while observing or assisting you in surgery. Watch how I perform the critical steps of. Do inform them prior what's your expectation, and also do inform them what you expect in terms of participation. After that, activate the learner by asking him to describe what was observed. The observation and asking the trainee back what is expected will definitely ensure that you identify the learner needs. And the discussion which can happen after that can revolve around teaching quickly what needs to be observed and understood and performed, and also in that process providing appropriate feedback. This is a very useful technique which I have also used in preclinical settings in my microbiology bench work time. But also, I have seen my clinician colleagues use it very effectively, both at bedside as well as in the surgical setting. Another model, which is usually Appropriate for experienced learner is usually the SNAPS model, usually considered as an outpatient model, more usually used in the medical or medicine related settings rather than surgical related settings. Just for your information, I'm stating it here. It's called SNAPS model. Probably we can modify this to suit the need, the surgical setting also, but usually it happens in these six steps. Uh, as summarize briefly the findings and narrow down the differential. A. Analyze the differential by comparing and contrasting the possibilities. Now it is opportunity for the learner to probe the clinical teacher by asking questions about his uncertainties, difficulties, and alternative approaches. Now that helps the first SNAP helps the clinical teacher to identify the need immediately, and then the learner describes his plan and uh, for the patient medical problems, and after that he or she says, or the clinical teacher, the clinical preceptor can also suggest a case or related problem for his or her learning with an appropriate feedback during that time. So this is another model which could help you. The models which I described, the 1 minute preceptor, the activated demonstrations, the snaps model, all are the so-called micro skills models. It helps to identify the learner's needs, it helps you to teach rapidly, and it helps you to provide feedback. These three are the micro skills a clinical teacher requires at his or her teaching on the run. So, to summarize, clinical supervision, the purpose is to provide safe and appropriate patient care, and in that process, provide training or learning opportunity. And in teaching on the run, identify the learner needs, teach rapidly, and provide feedback. And these are micro skills. And the micro skills portals provides you with a framework which will help to focus on the task of teaching when the time is limited. Thank you so much for your patient listening, and I hope this helped you to sum up whatever you already know and to provide a structure. Thank you so much for the opportunity to the Department of Surgery and the organizers of this event.